Terminologies and surfaces of tooth, division into thirds, line angles, and point angles. In the previous video, we learned the fundamental aspects of dental anatomy, including the various surfaces of a tooth and the basic terminologies associated with them. Now let us discuss how the tooth is divided into thirds and learn about line angles and point angles of a tooth. Dividing a tooth into thirds is like superimposing the tooth's surface of interest with a tic-tac-toe grid. Each box is 1/9 of the whole part and can be given a name based on its location. Why do you think we do this? This division helps dentists and oral health professionals to pinpoint specific areas of a tooth for examination, treatment, or communication. Now, try to recollect what was covered in the previous video. All teeth can be visualized from 5 aspects, including labial or buccal, lingual or palatal, mesial, distal, and incisal or occlusal aspects. The junction between the crown and root of a tooth is the cervical line. Let us take the maxillary central incisor and mandibular first molar from the labial aspect as an example. Now let's superimpose a tic-tac-toe grid on it. What do you notice? We see that the surface viewed is divided into 9 pieces. Cervico-incisally, we have the cervical, middle, and incisal third in a central incisor, which represents the parts close to the cervical line, middle, and incisal edge. Similarly, in the molar, occluso-cervically, that is, division from the occlusal outline to the cervical line. So the crown of a mandibular molar can be divided into occlusal, middle, and cervical thirds as shown. We can also go on to say the same from mesial to distal. Mesiodistally, it can be divided into mesial, middle, and distal thirds. Now looking at the tooth from a mesial or distal aspect, labiolingually or buccolingually, the crown can be divided into labial or buccal, middle, and lingual or palatal thirds. Likewise, how can we divide the root? We divide it cervico-apically, that is, from the cervical line to the apex of the root. So the thirds of a root are cervical, middle, and apical thirds. Let us relate clinically why we should use these terminologies. The crown of the teeth meets the neighboring tooth at a specific location called contact point. This is, for example, located at the incisal third in the incisors, middle third in the distal aspect of the maxillary molars. When restoring the teeth, it is imperative that we reproduce the same. If we know the normal, we can restore it optimally. Also, if there is some abnormality to be communicated to your colleagues, we may use these terms. For example, Agent Vinod has a food lodgement in the middle third of the maxillary central incisor. Now let us learn what is a line angle and a point angle. Let's take an example of a room. We can see that it has 4 walls, 1 roof, and 1 floor. Focus on the roof and any wall. How are they joined? What is formed at their junction? We see a line right which forms an angle of 90 degrees. This is the line angle formed by the 2 walls. Let's see how to name them. Say you have an edge formed by the meeting of a yellow wall and a green wall. You could call it the yellow-green edge because it's where those 2 colors come together. Now, just as you might describe an edge in a room by the 2 walls it connects, dental professionals use a similar concept to define angles on a tooth. So, a line angle is formed by the junction of two surfaces of a tooth that come in contact with each other, and its name is derived from those two surfaces. The junction of the mesial and labial surface is the mesiolabial line angle. Similarly, the junction of distal and labial surfaces is the distolabial line angle. From the lingual aspect, the junction of mesial and lingual surfaces is the mesiolingual line angle. Between the distal and lingual surface is the distolingual line angle. And incisally, we can appreciate the labio-incisal and linguo-incisal line angles. Now take a look at this illustration of maxillary first premolar. Try to name the marked line angle of the tooth. Choose the correct option from below. The correct option is D, occluso-buccal line angle. It is important to note that although we used an analogy of the room for line angles, the tooth surfaces are not very well defined. They are curves, so the line angles are also curved. These are extremely important to be reproduced for aesthetic superiority and color and shade transitions. In the figure here, you can see the labial aspect of the maxillary central incisor. The dotted line represents the line angles. As you see, it is a continuous line around the labial surface. If you see, the line goes along the cervical region also. Is there a surface there? No, but there is a slope formed by the cervical bulge, which forms the line angle there too. We will learn more about this later under the heading of aesthetics and smile line fabrication. Then what is a point angle? Now picture that you're standing in one corner of the room, but this time you notice not only the yellow and green walls, but also a blue wall coming together at that corner. You could now call it the yellow-green-blue corner. So at the corner of the room there are three surfaces, that is, two walls and a roof. What is formed? It's a single point. So it is called a point angle. To define, a point angle is formed by the junction of three surfaces that come in contact, and its name is derived from the three surfaces. Now, in order to name the point angles of an anterior tooth, you should be able to find out where three surfaces of the tooth meet. Yes, it's towards the incisal edge on the labial as well as the lingual side. So we can name the point angles as mesiolabio-incisal, distolabio-incisal, mesiolinguo-incisal, and distolinguo-incisal. Similarly, for a posterior tooth, the three surfaces come in contact at the occlusal surface. So the point angles are mesio-bucco-occlusal, mesiolinguo-occlusal, disto-bucco-occlusal, and disto-linguo-occlusal. Pop quiz. With that, we come to the end of this video. Please stay tuned for the next video, where we will cover the various terminologies related to the tooth surface characteristics.